Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about one of the more important exercises that I have patients do, and a very important muscle, quite frankly, which is called your glute medius muscle. Essentially, this muscle, it's one of the glute muscles along the side of the hip, essentially, and its main function is to do what's referred to as hip abduction, which is basically when we bring the leg out to the side. It's also responsible for keeping the pelvis parallel. So for pelvic stability issues, really important muscle. When this muscle is actually weak, what will happen in a lot of cases is the pelvis will actually drop when we weight bear on the particularly weak side. This also has implications with regards to lower back pain. It has potential with tight IT band, tight hamstrings. It can influence the knee. So there's several different conditions in which a weak glute medius muscle can cause different problems, different issues for people. So one of the more important non-weight bearing exercises to really try and isolate this muscle is called a straight leg raise on your side. So again, as I mentioned previously, this particular muscle is responsible for bringing the hip out to the side. So the way that you essentially do this exercise, it's really straightforward. You're going to lie on your side, and essentially you're going to keep your affected side that we're working on top, so in this case the left side. And basically the idea here is you're going to bring the leg up and slightly back. And this position of going slightly back is really important because in a lot of cases, if this muscle is weak, there's a tendency to overuse the muscles in the front of the hip there. And so again, in this case, when you're doing the exercise, you really want to isolate and feel the back portion of the buttock contracting, and you really don't want to experience any sort of contraction in the hip flexor, in the quads, or any of the muscles in the front of the leg that actually attach onto the IT band. So again, very specific when you're doing this exercise. In a lot of cases, I'll actually have the patient contract the muscle first, contract the buttock muscle first, isolate or set those core muscles first before doing the movement to make sure that they're doing it appropriately. Again, when this muscle is weak, there's a tendency to overcompensate with several muscles in the front of the hip and in the lower back. And again, it's why this muscle is so important to isolate and to do that exercise correctly. Please check, as always, with a physiotherapist to make sure that this or any of the other exercises are appropriate for you. And please also subscribe if you're finding these videos helpful. And as always, have a great day, and thanks again for watching. Take care.